Becoming an advocate absolutely changed my life as a nurse. As advocates, we are here to listen to our patients, understand what is important to them and what their goals are. So I was the lucky one that started to work with Solace first, and over time convinced Lindsay to join me. I did not think I had to do too much convincing.
She didn't. She really didn't. We're coworkers now.
Hi.
Hey Patty, how's it going?
Actually pretty good the last few days.
It's one of the biggest things that we can help with as patient advocates is helping the individual navigate technology and making sure that they don't lose communication with their care team. We can help bring all of the information to one place. We work directly with the patient and the other healthcare professionals as well. So for every, let's say, hour of time that we may be directly communicating with our patients, we're spending likely 3 or more hours doing the work to get them to those goals.
Could you look into transportation for me?
Absolutely. Yeah, I feel like it's so much better for you to not stress over having to try to drive yourself, especially if it's a little bit of a further distance.
You know, in the beginning, I was so sick that I couldn't figure any of this out, and that was mostly medical things. But now, it's things that are making my life better. Now that we know that I have the Parkinson's, there's still going to be other stuff that's going to happen as time goes on.
Being a patient advocate is definitely what I'm meant to be doing. The respect and gratitude that I get from the patients is unmatched. Mitch is also somebody who's had a really rough time with our healthcare system. To see Mitch be so independent from when we first started is incredible.
Hi, Liz.
Hi, Mitch.
Hi. I have flowers for you. There they are.
Oh, that's so sweet. Okay, so tell me what's been going on.
Paramatmane Namah. We bow to the true self. I've been what's called a meditation teacher, but the meditation I teach is really about love. It's not about mindfulness, it's much more about heartfulness. After the surgery, I couldn't pick up a spoon. My body was just fragmented. But once I met Lindsay, I could just feel that for the first time in weeks, I spoke to someone who had a sound of actually caring. And she just walked me through every single thing I had to do, every person I had to see. Within 3 days, my life began to turn around. I felt like it was entirely sorry. It brings me back, and I cried a lot on the phone with her. I cried a lot, and I was crying out of gratitude.
Advocacy offers so much that traditional nursing does not. Yes, you are advocating for them, but if your relationship is really great, they're also advocating for you too.
My patients are amazing, and as much as I care for them, they also care for me, and they really genuinely want me to take time off and care for myself. Hope is one of the most important things, especially when it comes to healthcare. Ensuring that you provide your patients with that emotional support and that hope and self-belief goes so much further than anyone could ever imagine.